Welcome back to Singapore Tonight. If you're just joining us, here are our top stories this evening. Singapore's alert for the novel coronavirus has been raised to the second highest level. The Disaster Outbreak Response Systems Condition, or DORSCON, was changed from yellow to orange after 3 new cases with no links to previous cases or recent travel history to China were confirmed today. The total number of cases now stands at 33. The DORSCON level at orange means that the disease spreads easily among people but is contained and not widespread. Precautions will be taken to reduce the risk of community transmission. For instance, organizers have been advised to cancel or defer large-scale events or proceed with precautions such as temperature screening. Schools will also suspend all inter-school and external activities immediately till the end of the March school holidays. Well, let's look at how the virus has spread in Singapore so far. 4 Singaporeans who've contracted the virus have no apparent links to previous cases or any travel history to China. They include the 3 new cases that were announced today. All other transmissions began from 4 main sources. Now, there are currently 17 confirmed cases of travelers from Wuhan, China. The first cases of local transmission occurred after a tour group from Guangxi, China, visited health product shop Yong Tai Hang at 24 Cavan Street. Now, 2 saleswomen, aged 28 and 48, as well as the tour guide who brought the tourists there, a 32-year-old woman, contracted the virus. They were said to have prolonged contact with that tour group. Now, one of the saleswoman's domestic helper, a 44-year-old Indonesian woman, also caught the virus. These 4 became the first cluster of local transmission, as revealed on the 4th of February. Now, thereafter, the same saleswoman's 45-year-old husband and their 6-month-old baby boy tested positive for the virus. The tour guide's 40-year-old husband, meantime, became infected as well. He worked at Diamond Industries Jewelry Company, which the tour group also visited. Now, separately, on the 30th of January, 92 Singaporeans were evacuated from Wuhan on a scoot flight. Since then, 2 women, both aged 47, a 41-year-old man and a 17-year-old man, have tested positive for the virus. A 42-year-old Malaysian man became his country's first case of the infection after he attended a meeting at the Grand Hyatt Singapore in January. 2 South Korean men, meantime, aged 36 and 38, who also attended that same meeting, were reported as confirmed cases. And a British man has also been diagnosed with the virus. The Health Ministry's investigations revealed that a total of 109 participants were at that meeting. 94 of them were overseas participants who have since left Singapore. 15 were Singapore residents, where one 27-year-old man is confirmed to be infected. 3 others have reported symptoms and were referred to the National Centre for Infectious Diseases. Now, the remaining 11 of them, well, they are well. For a closer look, Professor Paul Tambyah, President of the Asia-Pacific Congress of Clinical Microbiology and Infection, is here to talk to us.
Prof, thanks for coming in.
Hi.
Now, Singapore's raised its risk assessment from DORSCON yellow to orange. What does that mean?
Well, I think as you mentioned earlier, basically the main thing is cutting down on large gatherings. And they've said that it should be non-essential large gatherings, which means that essential large gatherings, such as weddings and funerals, can continue. And it's just that precautions have to be put in place, just similar to what we've already done, actually, at yellow. So there's no real need for panic buying or anything like that.
Which is something we have actually seen in the last few hours as well.
Mm-hmm.
Your thoughts as well on local transmission at this point? It seems there are 4 cases that appear not to be linked to anything that has been discovered so far. What would authorities be looking out for then when it comes to contact tracing with these cases?
Well, they obviously have to find out how these people got infected. And they've worked at it and they haven't found a reason. But sometimes the reason is not so obvious. It's only when you get 2 or 3 cases. Like, for example, the first Malaysian man, we were not entirely sure where he got the infection. And then when you had the 2 Koreans who attended the same meeting and then the British person who attended the same meeting, then it becomes more obvious. So that's where contact tracing is useful.
Professor Tambyah, I want to take you back to what Steve was asking just now about this issue of panic and this issue of what Singaporeans must be feeling right now that we are at this orange level. We know that it means that large-scale events, the suggestion is that the recommendation rather is that they cancel them or they defer them. But they don't have to do that, but they must put in place certain measures, right? Well, we've seen 3, maybe 4 people who attended that Grand Hyatt meeting as an example contract this virus. It was a large-scale event by any understanding. 109 people were there. So what does it mean? What can these organizers do to actually mitigate the risk then, apart from temperature screening and just noticing that someone is sick or not sick? It seems rather arbitrary.
Well, I think the first thing they have to do is what we've been doing all along, is telling people who are sick and those who have a recent travel history or those who have been in contact with a known case of the coronavirus to stay away. The other thing they can do is just simple things like spacing the way people sit. And I have to confess, I'm actually going to a wedding dinner tomorrow night. And I called the father of the groom and I said, so have you spoken to the venue? And he said, yeah, we're going to separate the tables and we're going to put better ventilation and make sure people can move around and they're not crowded. And for a disease that's spread by droplets, I'm pretty convinced I'm going to enjoy the wedding dinner tomorrow night.
Spread by droplets. What other measures then? Hand sanitizer?
Yes, of course. Hand sanitizers, hand hygiene, just simple, making sure that if you find somebody who's not well, you tell them to, very politely go and see a doctor.
So do you still accept their business card if you're at a large-scale event, or are we going to start seeing things being done sort of electronically? Would you recommend that? Because it's already been recommended. Look, if you don't have to shake someone's hand, find another way to greet them.
Yeah, I mean, I think that's being a little bit on the overcautious side because, you can usually tell when somebody is ill. But of course, this whole question about whether people are infectious the day before the symptoms start. So you're not going to be able to tell whether they're going to get sick tomorrow. But, this is one of the differences between this outbreak and SARS because we've got so much more technology. Like, for example, this morning, we had a briefing from the doctors in the National Center of Infectious Disease, and they told us all about the cases that they've been looking after and what are some of the things to look out for in terms of their laboratory and their X-ray findings and the clinical features. And more than half of the people attending the meeting were not there. They were doing it electronically through Zoom. So there's a lot of that happening. There's a lot of people working from home. I understand in MediaCorp people are working from home now, which I think is a good thing.
Yeah, it's something that I think a lot of companies will be looking to see how they can put that into place. So coming back to one of the patients, case 31, he had visited 2 GPs before he was admitted to hospital. Is there a concern that doctor hopping or could perhaps slow this sort of the identifying of patients down and that people might because the symptoms are so similar to other illnesses, that how do they differentiate between the two?
Well, I mean, obviously, if you go back to the same doctor, is better because the doctor can see that you're not better than when he first saw you, he or she first saw you. But with patient 29, for example, his symptoms changed, and even though he saw a different doctor in the practice, they had records, and he was able to communicate what had happened in between the first visit and the second visit. And so the second doctor recognized that something was wrong and called the ambulance, and true enough, he was diagnosed.
One of the pivotal cases is, of course, case 29, the first person who didn't have any previous travel history to China and didn't have any links to cases that we've already seen. He displayed symptoms of stomach problems. And we also know that initial reports out of China mentioned that some patients experienced something similar. So is that something that, people should be looking out for as they consider whether they're well or not?
Well, yes, because, it's not normal to have diarrhea or to have stomach problems. People do have chronic gastric problems, but if there is a change in your gastrointestinal symptoms, especially if it comes along with fever or with some kind of respiratory symptoms, then that's probably a good time to see your GP. And GPs know that viral pneumonias are sometimes associated with gastrointestinal symptoms, not just from this coronavirus.
And a question about healthcare workers. We know that people that are sort of been confined to isolation rooms for confirmed cases, but how do we ensure healthcare workers that have prolonged contact with patients also stay safe? We heard the sad news today of one of the doctors that was actually one of the whistleblowers to identify that this was as severe as it was, has passed away from contracting the virus himself.
Well, you know, in Singapore it's very different because all the healthcare workers are trained and retrained on the use of personal protective equipment, and there's plenty of personal protective equipment around the hospitals. In fact, we had to kind of hide our masks to make sure that they didn't walk away with the visitors. I had to do my own PPE or personal protective equipment refresher training yesterday, and fortunately I passed.
Okay, well,
that's good news.
Yes.
Thank you so much for coming in and talking to us about this this evening. Professor Paul Tambyah from the Asia Pacific Society of Clinical Microbiology and Infection, and do enjoy your wedding tomorrow.
Thank you.